All right, so we will get started in just a moment, but I will go ahead and welcome you all and do our little introductions here. So we would love to welcome you to our NCLEX dosage calculation webinar. We are so excited that you've chosen to join us here today, and I'd like to introduce Courtney. If you weren't on before, Courtney is in our chat, and she's going to be helping to moderate and answer any questions. Her specialty is in mental health, and she helps with all our mental health content on the website. So she'll be in there helping to answer questions and share different links with everybody. I'm Miriam, and I'm one of the nurses here at Bootcamp. I work with some other fabulous nurses to create cases and questions. Our video walkthroughs you might have seen, they're loved by so many people. So if you haven't seen those, go check them out. I've been a nurse for 15 years, and I started in med-surg and hospice and then transitioned over to the New Life Center because med-surg was not going to be my permanent home, and I love where I am now. And then my favorite nursing job is here at Bootcamp, where I get to work with a great team and help all the students prepare and pass for their NCLEX. So we know that dosage calculations can be very intimidating. I still get intimidated, and it's nice to just take your time and step back and learn the steps. And so we're going to go over all of that. So we've put together this webinar for you all. If you have questions, you can enter them in the chat. Courtney's in there to moderate and answer your questions. And at the end, we'll allow a few minutes just for some live question and answering. So let me share my slides and we'll get started. All right, so let me find my mouse first. All right, so we are going to be going over two types of methods to do dosage calculation. We're going to do dimensional analysis and ratio proportion. So these two methods are commonly used to solve dosage calculation problems. Now, in practice, in clinical and school, you might be given like a picture of medication label or just maybe some written orders. And maybe you're even being asked to work backwards to see if the amount you've pulled up is the correct amount, correct dose. All of these different things happen in practice, and you need to be able to quickly move between different units and information to determine if what you're giving the client is the right amount of medication. So we can use both of these approaches to take on our questions. So dimensional analysis is going to be like a standard approach. You plug in all your numbers, cancel out units, and solve. And then our ratio proportion is going to be where we use fractions. You're making a comparison, and this is where we're going to solve for X. So how many of you are you dimensional analysis people? Are you ratio proportion people? I personally am a dimensional analysis person, but both of these methods are great, and I'm going to give you steps to break down each one so that we can apply them to all of our dosage calculation questions. All right, so first let's go over some steps for dimensional analysis. So you're going to compare what you have versus what's desired. So just think about what you have is going to be like that medication label that you're given. And then your desired is what you're looking for. Am I looking for how many tablets or how many milligrams, milliliters, whatever it is that they are asking you to solve for? Maybe you have like a powdered vial and an order that you need to reconstitute a medication and determine how much liquid medication to drop. That would be what your desired is, what you're looking for. You set up your equation so your units cancel. You're going to multiply across the top and the bottom and then divide. And then we're going to round and check our work. Of course, round properly or else your answer could be incorrect. And we will break down each of these steps when we get to our problems. Okay, so let's look at our steps and rules for the ratio proportion method if you prefer this method. So first you're going to identify your known and your unknown, okay? So same type thing with our dimensional analysis. Then you're going to set them up as proportions or these fractions and cross multiply. Now you will repeat these two steps over and over until you get to the desired units. And then of course our verification at the end that we always want to do. Now, ratio proportion has some set rules, and I could not understand ratio proportion method until I understood these rules. So you have to make sure that your units in your numerator are the same, and then your units in the denominator must be the same. But if they're not, don't worry, we're just going to convert to get them to be the same, and then we'll be able to work out our math. If you don't do this, your math is not going to math, it's not going to work out. So you have to follow these rules in order for ratio proportion to work. Okay, So I wanted to set up here, this is a very little easy equation where you probably don't even need to set it up. You could just look at it and answer the question. But I wanted to use a general equation just to show you the setup for both dimensional analysis and ratio proportion before we get into some real practice problems. So for dimensional analysis, you're going to set it up where you're going to put what you have on the left side and what you need on the right side, and then you plug in all your other numbers, where here we just have one other number to plug in. So on my right side, what I'm solving for is my milliliters per day. And on my left side, I'm going to put what I have. So I have 1 milligram per 1 ml. Now I'm going to put my 1 ml up top over 1 milligram. And the reason being is whenever you plug in your numbers, you want the opposite. So for example, if I put my milligrams up here, 2 milligrams per day, then my milligrams are going to cancel and I'd be left with milliliters per day, which is what I'm trying to solve for. So that's all you have to do is plug in the numbers. So here we would take our 1 times our 2 and get 2, our 1 times our 1 day, and get 2 over 1. And so we know that we're going to give 2 mLs is going to be how much we administer. Now, when we look at this in a ratio proportion method, we're going to read this as 1 gram equals 1 ml, right? When we pull up 1 ml, we have 1 milligram of solution. So that's our volume that we know. And then what we don't know is how many mLs. So we're going to label that as X, and that's how we're going to solve it. All right, so we're going to read this as 1 milligram over 1 ml. And then what we don't know, what we're trying to find out, is we have 2 milligrams, and we want to know how much, our X mLs. What is that going to equal? So we verify here that we have the same units. So we have milligrams on top, we have milliliters on the bottom. So we're good. We have the same units, and now we can cross multiply. So you do your 1 times your X ml. So we get 1 X ml equals our 2 times our 1. So we're getting our 2 there. And then remember that we have to divide by 1, just our general algebra here, to get rid of that and get X alone to solve for X. So here we see again that X is going to equal our 2 mLs. So that's just kind of a standard way to approach these. And now we can apply both of these methods. Okay, so here is a question right out of our question bank that looks just like the NCLEX. These are standalone questions that are fill in the blank. The NCLEX will tell you how to round, you just have to read it and what you're looking for. So let's look at this question together. The nurse is caring for a client taking acetaminophen 2,600 milligrams per day in 4 divided doses. The nurse reviews the medication. How many tablets per dose does the nurse expect to administer? Record your answer using a whole number. So here we're told that we need to find a whole number. It might say that you want to round to 1 decimal place. This is where you're going to check for your rounding rules to know how you should verify at the end. At the right of the answer blank, you can easily see what you're looking for. It's also up here, but we can see here that we're looking for how many tablets we're going to be given. Okay, so let's apply our dimensional analysis steps. So the first thing I do is I ask myself, what do I have? I have this acetaminophen in my hand, and I see on the label that I have 325 milligrams per tablet. So that's my medication concentration. The other things I can look at that the question is giving me is that I have 2,600 milligrams ordered per day. Okay, and then I see that I'm giving this in 4 divided doses. Okay, so we've gotten all this information, and now we're gonna look at what we need. Okay, so remember, we can find that simply right after that answer blank. So I see that I need to find out how many tablets per dose I'm giving. Okay, so now that we know our given units and what's desired, we can set up our equation. So remember, on the right side, what are we gonna put? We're putting what we're looking for, right? So we'll put tabs per dose. And then remember, what are we putting on the left side? You're putting any of your given information to start with. So I'm starting with this one, our 2,600 milligrams a day. And I check it off as I go, just to make sure I don't accidentally re-plug in a number anywhere. All right, so now that we have the start of the equation set up, we know where we're starting and where we're going, we can fill in our other numbers. All right, so I've already put in my 2,600 milligrams a day, my tablets per dose. So next I can take any of these and I'll take my 4 doses per day, and I'm gonna put my 1 day on top and 4 doses down here at the bottom. The reason being is that this will allow my days to cross off because I'm trying to get to tablets per dose, so I need to get rid of day. So now this leaves me with doses at the bottom, which is what I need. And then I'll take this 325 milligrams per tab, and where do I want to put my milligrams? Am I putting that on top or the bottom? I need it to cancel, right? So I'm going to put my 325 milligrams at the bottom so my milligrams will cancel. So here I see I've set up the middle, I can cross off my units, and I'm going to be left with tabs per dose. All right, so let's do our multiplication. So you're going to take 2,600 times your 1 times your 1, and what do we get? The easiest math we're going to do all day. 2,600, right? Okay, so then we're going to do the same thing at the bottom. 1 times 4 times 325, and what do you get? 1,300, right? Okay, so now we can take those numbers and divide. So what do we get? 2,600 divided by 1,300. 2, right? 2 tabs per dose. Perfect. Okay, so now we just want to do our verification and make sure we have the right answer. So we know that it was asking for what? A whole number, right? So we don't need to do any rounding or anything here. We have our whole number. The other thing is you can plug your number back in and see if all the math works out, and just ask yourself, does this make sense? If you were to get some crazy number like 15 tablets, we're not going to give a patient 15 tablets, or I hope not. That would seem strange. You might want to go back and check your math. Or if you got like 2.3, right? We're not giving 0.3 of a tablet, maybe 0.5, half a tablet. But anything that might seem off, go back and just double check everything. And we see that that's correct. All right, so let's look at the same problem and apply our ratio proportion method, okay? So we've already worked this problem, so we know kind of our known and our unknowns, right? So the best thing to do here, and this is where a light bulb went off for me with ratio proportion, we want to plan out our steps. Otherwise, it just kind of seems like we're pulling random numbers from everywhere. So the first thing I know I can do here is I can take my milligrams per day. And if I know my milligrams per day, then I can figure out my milligrams per dose. And then from there, since I have this known amount here, I can get to my tablets per dose. So these are the steps that will go in order. So we need to set up our proportion. So with ratio proportion, remember, it's not where our units are opposite, like with dimensional analysis. They have to be either both on the top or both on the bottom. They have to match. So we can start with our dosage per day, which was 2,600 milligrams. And remember, we're giving it in 4 doses. So I think of this as a relationship, okay? So 2,600 milligrams is given in 4 doses. Those are related. And then we want to figure out, we're trying to get to that milligrams per dose, right? So we're trying to figure out X milligrams, so how many milligrams per 1 dose. So we're just verifying here that our units match. We have milligrams both on the top and we have doses both on the bottom. So now we can cross multiply and solve. So you're going to cross multiply. We do 2,600 milligrams times our 1. So we get 2,600 times our 1, which is 2,600. And then our X milligrams times our 4 doses. So what are we going to put here? We're going to put 4X, right? Okay, so we have to get X alone, right, to solve for X. So what do we have to do? What are we going to divide by? 4, right? So that we can get our X alone. So what do you get here? X equals 650 milligrams, right? Okay, so we've done our milligrams per day, and we've gotten now to our, we have to set up another proportion because we've got to get down to our tablets per dose. We've gotten our milligrams per dose. Okay, So we take our 650 milligrams and we are going to put that over, what are we going to put that over? X tabs, right? We want to know this relationship. We want to know what the relationship is. 650 milligrams is how many tablets. And then we're going to take our known here, our 325 milligrams to tablets. So what are we putting up top? Our 325 milligrams, right? Because we need our units to match. And then we're putting that over tablets, 1 tab. Okay, so now we see our units match, right? We have milligrams up top and tabs on the bottom, and we can cross multiply. So we do our 650 milligrams times our 1 tab, and we get our 325 milligrams times our X. Okay, so we get 650, 325X, and then what do we have to do? What are we going to divide by? 325, right? So that we can get X alone and solve for X. And so what do we get from this? X equals our 2 tabs, right? All right, so a way to verify with the ratio proportion is, again, you can plug those numbers back in. So you could put the 2 in here in the X place and just continue to work backwards to see if you get where you started from. We verify that it's not some crazy number of tablets or, we have our whole number, which is what we were supposed to end with. And of course, we see we're correct. Okay, so let's take on one more problem that we'll do the same way, dimensional analysis and a ratio proportion. Now, this one is going to be more challenging because we have a weight conversion, but you are ready for it. So let's read this together. The pediatric clinic nurse is reviewing the medication for a 2-year-old client presenting with acute otitis media. The nurse has an order to administer amoxicillin 90 milligrams per kilogram per day, divided into 2 doses. The client weighs 24 pounds. How many milliliters per dose should the nurse administer? Record your answer using 1 decimal place. Okay, so right here we see our rounding. We need to do 1 decimal place, so we'll keep that in mind for the end. We see what we're looking for, which is our milliliters, right here to the right of the answer space. And I'm going to ask myself, what do I have? So looking at our label, I'm holding this amoxicillin suspension in my hand, and I see that I have 400 milligrams of amoxicillin in 5 mLs. Okay, so some other things that I know my given units are that we have this 90 milligrams per kilogram per day. That's our ordered dose, and we're going to give this in 2 divided doses. And then my dosing weight is 24 pounds. Perfect. So let's look at what we need. So what do we need here? What are we solving for? We want to learn how many milliliters we're going to give, right? So milliliters per dose. Okay, so let's set up how this equation is going to look. What am I putting on my right side? I'm putting what I am looking for. So what are we looking for? Our milliliters per dose, right? On my left side, you can plug in anything, but it's going to be easiest here if we start with our weight conversion. So we'll start with our 24 pounds. And we just put it over 1. Think of it as 1 person on the right side or on the left side. And then we're trying to get to this milliliters per dose. So now we can set up our middle. Okay, now I've already used my 24 pounds and I've plugged in my desired units. So I'm going to check those off. And then normally we look at our given units to plug in information, but because we have to convert this information is just something you have to memorize. So what do we know? How many pounds are in 1 kilogram? Right? We have 2.2. So we're going to put 1 kilogram over 2.2 pounds, right? Because now our pounds can cross off. All right, so we've gotten our kilograms figured out. Now we can take our ordered dosage, which is our 90 milligrams, and you're just going to put it over kilograms per day. You just put both of them at the bottom there. So now what do we cross off? Our kilograms, right? So we're left so far with milligrams per day. So still not quite where we need to get because we need to get to milliliters per dose. So next I can take my 2 doses per day, and I'm going to put my day where? On the top or the bottom? On the top, right? Because we need it to cross off. 2 doses. Okay. And then the last thing we can plug in is our medication concentration. Our days cross off here. So we have milligrams per dose. So now we need to cross off our milligrams to get to milliliters. So I have milligrams up top here, my 90 milligrams. So I'm going to put milligrams on the bottom so that we can cross it off. Whoops, I didn't mean to put 90, I'm sorry, 400 milligrams. And then our 5 mLs up top. So now I see that my milligrams cancel off and I'm left with milliliters per dose. Okay, so something I just want to clear up and make sure that you guys all understand, because this took me a little bit to understand. You can, as long as you keep your facts together, like the 400 milligrams and the 5 mLs, you can put either on the top or the bottom. You just arrange it so that your units will cancel. So they have to be opposite to cancel. So that's why sometimes we put one thing on top and the next time we're putting something else on top. So you just want to make sure everything cancels out. And here we see we'd be left with milliliters per dose. So now we can do our multiplication. So we're going to take our 24 times our 1 times our 90 times our 1 times our 5. And what do you get there? We have big math here. 10,800, right? All right, so now we're going to come to the bottom and do 1 times 2.2 times our 1 times 2 times our 400. And what do you get there? 1760, right? Okay, so now we can divide this. So we're going to take our 10,800 divided by 1760. And what did you get? 6.13, right? Okay, but remember we have to round here. And it said to use 1 decimal place. So you're going to take that first decimal place, the tens place, you're going to look over to the right. And if the number is 5 or above, we're going to round up. But here we're less than 5, so we're going to drop that 3 off and we're left with 6.1 milliliters. Everyone agree? So you can verify this, you can plug your numbers back in, make sure everything makes sense. All right, we see that we're correct. So let's take this same problem and put it into our ratio proportion method. So again, we already know our known and our unknowns here, and we can plan our steps out. So we can take our pounds, our 24 pounds, and we can convert that to our kilograms. And then what are we gonna do? We can take our kilograms, since we know that, and take that 90, and we can figure out our milligrams per day. And then we can go from there and figure out our milligrams per dose. And then last but not least, we can take that with our known amoxicillin label and figure out our milliliters per dose. Okay, so the first thing is gonna be to do this first proportion, which is gonna be to figure out this weight. Because remember, you can't just plug a pound and a kilogram in, they have to be the same, right? Because we can't have different units. So we're gonna take the 24 pounds, and we are trying to figure out how many kilograms that is, right? So we're gonna put that over X kilograms. That's the relationship we're looking for. We're trying to figure out how many pounds is equal to how many, or how many 24 pounds is how many kilograms. So we're gonna then over here put the relationship. So this is our conversion. So how many pounds are in 1 kilogram? 2.2, right? So we're gonna take our 2.2 pounds over 1 kilogram. We verify that our units match. We have kilograms both on the bottom and we have our pounds both on the top. All right, so now we can cross multiply here. So our 24 times our 1 is 24, and we get 2.2 X. And then what do we have to do? We have to divide, right? So we got to get X alone to solve for X. And we figure out that this client's weight is how many kilograms? What'd you get? 10.9 kilograms. Perfect. So now we've taken our pounds, we've gotten our kilograms, and we can do our next proportion, ratio proportion, which is going to be our milligrams per day. All right. So we've converted that weight. We know what we're going to do. We can find out this relationship. So we're going to find out the relationship between the kilograms and the milligrams. So we put our X milligrams, because that's what we're trying to find out. That's our unknown, over 10.9 kilograms. Okay, so that's the relationship we're trying to learn. Now, what do we know? we know that there's 90 milligrams per kilogram is what's given, right? So 90 milligrams per 1 kilogram. So we have kilograms both on the bottom and we have milligrams both on top. Okay, so our units match up and now we can cross multiply. So when you cross multiply here, we're going to get our X milligrams times 1 equals our 90 milligrams times our 10.9. And we are going to get what? X equals, what's 90 times 10.9? 981 milligrams. Did you get that? So we know that this client is getting in a day 981 milligrams. So now we've completed that and we need to work on our next proportion, which is our milligrams per dose. Okay, so we have our 981 milligrams here so we don't forget it. And that's a 1 day. So we give this in 2 divided doses, right? These are going to be our related facts. So we have 981 milligrams in two doses. And then what are we trying to find out? We're trying to figure out X milligrams. We want to know how many milligrams are going to be given per 1 dose. So here we have our doses matching up at the bottom and we have our milligrams up top and we can cross multiply. So when you cross multiply here, we get 981 times 1 and we get 2 doses times our X. So our 2X. And of course, 981 times 1 is 1, and we have to divide by 2 to get X alone, right? So what do we get here? X equals 490.5, and that's our milligrams per dose. And something I want to point out here is you don't want to do anything with that 0.5. We don't want to round up here. You want to wait till the end. So you're going to carry all your decimals through, so that way we don't lose anything and get off by any numbers when we get to that final answer. Okay, so we have one final ratio proportion to figure out, right? Because we're trying to get to our milliliters per dose. So we're going to take that 490.5 milligrams and figure out how many milliliters. So how are we going to set this up? We take our 490.5 milligrams, and what are we going to put that over? X mLs, right? Because we want to learn the relationship between 490.5 milligrams to how many mLs. So what do we know here? We know this, right? We know that we have 400 milligrams per 5 mLs. All right, because that's that relationship. So now we have our milliliters on the bottom, our milligrams both on top, and we can cross multiply. So we take our 490.5 times 5 and our 400 times our X. And what's 490.5 times 5? Did you get 2,452.5 equals 400 milligrams X. So now we have to divide, right? We got to get that X alone. So we divide both sides by 400 to solve for X. And what did you get? 6.13 again, I hope. So remember, with that 6.13, we're being asked to round to 1 decimal place, right? So we are going to drop that 3 since it's less than our 5, and we're left with 6.1 milliliters. And of course, we see we're correct. So where can you guys find us? I hope that this has helped and you want to go find some more dosage to practice. You can go to our bootcamp website, bootcamp.com/NCLEX, and Courtney will be sharing these links for you in the chat if she hasn't already. So if you want to go there, we have a large question bank that has everything you need to prepare for the NCLEX. You can go to the website, use the question bank, as well as check out our case studies and those case study video walkthroughs that I talked about before that so many people love. And if you go into our pharmacology section, you'll see more dosage questions that you can take on and put this steps to practice and do them for yourself. There's also detailed explanations if you get hung up on anything. And then you can follow us on all of our social links there. Join our Facebook study group. Be sure to be in there and be on the lookout for more webinars. We've heard the feedback that you guys are really enjoying them. So we'll be planning some more in the future and we can't wait to see you again soon. Now we have a few moments left, so we'll open it up for any questions that you have. It looks like you guys are doing great with your math I'm seeing. I'm so glad that you could join us. Kelly, I'm not sure your question. Is there a name for method if someone does the question and steps? Yes, so we have if you go to the bootcamp website, you'll see that we have pediatric calculations, all kinds of an array of fill in the blank dosage calc for you to take on, which is going to be lots of that reconstitution, like that last one, like lots of weight base. Are you guys feeling better about these dosage calc questions? I know dosage is so tricky. Hopefully it helped. All right, well, if there's no other questions, I'm so glad you guys could join us today. And follow up on a little bit later. There'll be discount codes put in that Courtney probably shared with you to get 25% off for the website. And then there's just going to be a giveaway announced later for everyone that attended, or somebody will get a free 3 months. So be on the lookout for that. Kelly, what do I mean? Yes, so the website, if you go on, just like how I did, they break them up. It's all broken up into steps, the explanations, as well as if you go in there, there's a link to the ratio proportion, and those are also broken down in steps. And it really, especially with the dimensional analysis, as long as you're plugging all those numbers in and your units cancel, you can put it pretty much in any order, as long as you have what you're working with, what you start with, and then where you're trying to get on the right side. Yes, during the NCLEX, you're given something to write with so that you can, and there's a calculator. So yes, no, we're not doing any of this in our head. Believe me, I would fail horribly. All right, guys, thanks so much for joining, and we can't wait to see you again next time.